going to turn it over to you. Thank you.
All right, thank you very much. So tonight we're going to be talking about an exciting topic. It's entitled Arresting Prostate Cancer Development. The entire presentation is going to comprise of 5 points. Obviously, we need to understand the clinical presentation of prostate cancer, the many phases. We're going to also discuss the metabolic nature of prostate cancer, otherwise known as pathogenesis. And we're going to find out how does lifestyle impact our risk, also utilizing clinically validated nutrients to optimize prostate cancer treatment. And finally, stepping outside of the conventional world and using repurposed drugs to target prostate cancer cells. So one of the first things I want to bring to your attention are some statistics. And obviously, these are concerned because we think of our dad, we think of our nephews or cousins, so forth, so on. About 30,000 men will die of prostate cancer in the year. That's approximately 18 minutes a man will die from prostate cancer. So that's pretty serious, nothing to ignore. 1 in 6 will be diagnosed with prostate cancer during their lifetime. Prostate cancer is the second leading cause of cancer death in American men. Can anyone tell me number 1? Lung cancer. Thank you very much, sir. And finally, 1 in 36 will die of prostate cancer. So it's nothing to ignore. It's a growing epidemic, and it's something we should be paying close attention to. Now, here we have some of the clinical presentations of prostate cancer. What should you look out for, and what are some of the potential side effects or symptoms? So number 1, you'll see bloody urine, otherwise known as hematuria. Obviously, at this point, the cancer has protruded into the bladder wall, which is causing some level of blood. We're going to look on number 2, 3, 4, and number 8 together, and that looks on your ability to urinate. So obviously, some individuals have a difficult time voiding or urination, right? For some people, they have excessive urination during the nights, otherwise known as nocturia. Now, if you're not voiding properly, one of the potential concerns is number 6. Now, what do you see for number 6? A burning sensation. And what does that mean? It potentially means a urinary tract infection. So remember, if you're not voiding, that urine is the perfect environment for bacteria to grow. So one of the things I would encourage you, ask your doctor to do an ultrasound of your bladder to see if you're retaining any urine in your bladder, and that can be a concern. Number 7 looks on erectile dysfunction. Erectile dysfunction is usually a reflection of a bigger issue. Sometimes it can also be a problem with heart disease, but ED is also associated with prostate cancer. Now we're going to move on to feeling tired or weary. A lot of men I speak with, they will say, hey, Dr. Walker, I feel tired. I think I'm experiencing low testosterone. And they could be correct, but many times in some situations, it could be because of prostate cancer. And remember, cancer is pretty much like a parasite. And what it does, it literally siphons your energy reserves. So it steals your energy. So one of the side effects of especially advanced cancer is what? Tiredness, fatigue, feeling unmotivated. And finally, number 10, you'll see lower back pain. Obviously, if there's lower back pain, you're thinking of what? Arthritis, right? You think of stenosis. But lower back pain could be a potential issue for what? Cancer metastasis. And remember, one of the first areas that cancer likes to migrate to is where? The bones. And one of the reasons for that, your bone is rich in growth factors. And the cancer cells can sense that. And they use these growth factors to grow, proliferate, and metastasize. Let's move on to the next slide. Now, whenever you're dealing with prostate cancer, it's very important to understand what? Your personality. Every cancer is different. For example, we're going to look on Gleason 6, and we're going to compare it to Gleason 9 to 10. Now, basically, this diagram or table is reflecting individuals who did a radical prostatectomy, and they were followed for 5 years, and they're looking to see if the cancer came back at the 5-year period. So let's look on group 1. All right, so group 1 is a Gleason score 6. And as we know, Gleason score 6, is it aggressive or is it passive? It's passive. It's low grade. So Gleason 6 is a low grade cancer. And take a look on the percentage. It's only 5%. There's a 5% likelihood of recurrence at 5 years. That's pretty good. That means that this person is virtually free of prostate cancer. Now, let's compare that to Gleason 9 to 10, which is group 5. What do you see for group 5? For recurrence? What number? 76%. So that's a difference of what? 71%. So if someone is dealing with prostate cancer, which is Gleason 9 or Gleason 10, there is a likelihood that the cancer is going to come back at the 5-year period. And that's pretty scary. So again, you're seeing that personality of the prostate cancer differentiates how aggressive or passive your cancer is. And by the way, if you have any questions during the presentation, I'm open. I don't mind to interact with my audience during the presentation. So again, it's an open floor, and we're here to learn from each other. Now we're going to move on to location, location, location. And by the way, this is not a plug for real estate. This is actually about prostate cancer. And here you're basically seeing the median survival of prostate cancer depending on where the cancer has metastasized to or migrated to. So for example, if you see the cancer, the median survival for lymph nodes is 32 months. Pretty impressive. Compared to the median survival of lungs is only 19 months. And what about the liver? 14 months. So depending on where the cancer spread to or metastasized, basically that can determine overall survival. So it's very important that you keep that in mind. Now we're going to talk about risk factors. So essentially, there are certain things that we want to keep very close to our attention. Number one, age. The older we are, the more likely the cancer may fester or there's an increased risk of cancer. So obviously, if someone is 40 years old versus someone who is 65, the person who is 65, they're more at risk. It makes sense. Family, if your brother or your dad has prostate cancer, it can potentially double your risk. Also, ethnicity. African Americans are 3 times more likely to be diagnosed with prostate cancer, and their prostate cancer tends to be more aggressive. So that's pretty scary right there. Genes. We know that genetics plays a role in cancer formation. Believe it or not, 5% of all cancers today are because of genes. 5%. Only 5%. And if you suspect there's a gene defect, that can increase your risk of prostate cancer. For example, if a man has a BRCA defect, BRCA meaning what? B-R-C-A, right? And that's associated with what? Breast cancer. That's associated with ovarian cancer. But also, if that man has BRCA2 defect, it can increase your lifetime risk of prostate cancer by 40%. So again, if there's a strong family history of cancer, not just prostate cancer, you may want to see a genetic counselor to examine to see if you have a BRCA defect. Okay, again, that's BRCA2. But we want to spend more of our time looking on lifestyle. How does lifestyle affect cancer risk? Now, there are potentially 4 triggers that can fuel prostate cancer cells. 4. And we're going to talk about insulin, sugar. We're going to talk about inflammation. We're going to talk about hormone imbalance. And we're going to spend some time with hypoxia. Now, hypoxia is what they call what? Low oxygen level. And we understand that cancer cells thrive in an oxygen-deprived environment. So cancer cells prefer an environment low in oxygen. So if you are someone who is anemic, you struggle with anemia, you're pretty much in a hypoxic state. Why? Because you require your red blood cells to do what? Trap oxygen. For example, if you're not practicing deep breathing exercises, you're more at risk for hypoxia. You're pretty much putting yourself in a low oxygen environment. Remember, according to Dr. Otto Warburg, he found that cancer cells prefer an oxygen-deprived environment. So please, aerobic exercise, deep breathing exercise, and make sure you address any nutritional deficiency. For example, make sure you're taking your B12. Okay, that's very important for your red blood cells. If you need iron, make sure you're supplementing with iron so you can make some effective, robust red blood cells. Now, the next slide is basically referring to trigger number 1, insulin sugar. According to the New York Times, sugar is considered to be a toxin. Can you believe that? Sugar is literally considered to be a toxin. And I would agree with that. And the reason why, sugar can affect various pathways. And we know that sugar is the primary food source for cancer cells. If you look on a typical cancer cell, you'll see 10 times the receptors for sugar versus a healthy cell. So obviously, they have a craving for glucose. So if you're feeding that cancer, you're potentiating a more aggressive cancer. Now, let's take a look on this study. 10 healthy people were assessed for fasting blood glucose levels. And they also looked on their phagocytic index of their neutrophils, meaning you're examining how well the neutrophils engulf bacteria. Now remember, neutrophils are like your police force, right? They're a part of your immune system. They destroy and they kill bacteria. However, if you consume 100 grams of carbs, what did I say? 100 grams. You can significantly decrease your capacity of neutrophils to engulf bacteria. Now, what is the point of this study? If you are decreasing your capacity of your neutrophils to work, we can easily assume that you'll decrease your capacity of your immune system to destroy what? Cancer cells. And for example, when you think of 100 grams of carbs, what comes to mind? For example, you may have a bowl of cereal. Personally, I like Cheerios. I don't like it anymore because according to a new report, it's filled with Roundup. But a bowl of Cheerios plus a bagel with cream cheese plus a glass of orange juice, you might decide lunchtime you may feel for a Subway sandwich. Right there, you have already exceeded 100 grams. Just by your dietary intake, you're influencing your immune system. Now, I want to share with you this study. This study is looking on insulin resistance versus insulin sensitivity. Now, my question to the audience, do you prefer to be insulin resistant or do you prefer to be insulin sensitivity? Which one do you prefer? Sensitivity. Anyone said resistance? So yes, it's sensitivity. Now, they found that men at the highest level of insulin resistance, they're 3 times more likely to have prostate cancer. That's pretty scary. So if your insulin level is very elevated or pretty high, and it's elevated for prolonged periods of time, you are predisposing yourself to prostate cancer. And the reason why this is so, insulin is a growth hormone. And that's one of the reasons why diabetics, okay, people who struggle with blood sugar, they tend to have the highest incidence of cancers, including prostate cancer. Conversely, men with the highest insulin sensitivity had a 65% reduced risk of prostate cancer. So clearly, we're seeing that insulin plays a role in prostate cancer development. Now, we at Life Extension, we have different standards. For example, if you go to your typical doctor and they test your insulin level, the typical range is what? 0.6 to 24.9, okay? From a Life Extension standpoint, we want to see your insulin less than 5. And the reason why, if it's less than 5, you're getting the anti-aging benefits, and also you're trying to reduce your likelihood of cancer. So typically, if you do a physical, always ask your doctor to check your insulin level. I can be vulnerable. My dad struggles with diabetes. So obviously there's an increased likelihood of me struggling with diabetes. So one day I decided to do a blood test. And my blood sugar was amazing. My blood sugar was 84. Amazing. In fact, it met the Life Extension requirements. I was very excited. However, I decided to do an insulin test. And by the way, I was fasting for this test. My insulin came out to be 25. And what I'm trying to convey to you is, one, with such a high insulin, basically my pancreas was working overtime to lower the blood sugar. So I needed to work on my diet. So even though my glucose was very good, if I did not test my insulin, I would never know I was in insulin resistance. Remember, insulin sensitivity is less than 5. Now, let's move on to inflammation. So, is inflammation bad? I'm sorry?
We got a question here, if you don't mind.
Yes, please, go ahead.
In the previous slide, you showed figures for insulin, and you made some inferences or implications about sensitivity. I have only had a glucose tolerance test twice in my life, and do the figures you have up there relate to either hyperglycemic or hypoglycemic? Great question.
So essentially, if you are producing too much insulin, that can put you in a hypoglycemic. That's with an O, meaning low blood sugar.
You said too much insulin or just a lot of insulin?
Too much insulin, because all that insulin is going to transport your sugar from your blood to your cells. So there's going to be a dip, and they call that hypoglycemia, low blood sugar.
So a person who's hypoglycemic has a higher risk usually of prostate cancer?
Well, I would not necessarily draw that conclusion without testing your insulin level. And that's very important. And by the way, you mentioned a very important test, a glucose tolerance test. It's typically done for 3 hours. So every hour, for 3 hours, you're checking your blood sugar and you're checking your insulin. And if you find that your insulin after 3 hours is still elevated, there is an increased concern with metabolic syndrome, and that can also increase cancer risk.
We have another question, doctor.
Please, go ahead.
A question about the carbohydrates. On that slide is, if you have 100 grams of carbohydrates, it significantly decreases your neutrophils' ability to encapsulate bacteria or whatever. But the bacteria are not related to causing cancer. So how does that relate to the cancer risk?
Great question. Great question. So remember, cancer, basically, we all have cancer cells. I think you'd agree with that. And our immune system is responsible for what? Destroying those latent cancer cells. Now, if you're putting your body in a state of immune senescence, and immune senescence simply means a decline in your immune system, your immune system is now going to be revved up, efficient enough to target that cancer cell. So essentially, even though this study pertains to bacteria, it's still relevant because you're still affecting your immune system, which is responsible for doing what? Destroying cancer cells.
Thanks.
Yeah, sure. Any other questions? Any other questions?
One more.
All right, so let's move on to inflammation. So is inflammation a bad thing? And that's a question for the entire audience.
Yes.
No, it's not. Acute inflammation is necessary. If you're dealing with a bacteria, your body generates inflammation. So that's good, right? You want to kill that bacteria. If you're dealing with a cancer cell, your body generates acute inflammation. That's also good. The problem is chronic, long-standing inflammation. That's the problem. If you notice the picture, you see a dog sitting there surrounded by flames. Apparently he's drinking a cup of coffee. I don't drink coffee, so I'll say a cup of tea. And you see the smoke, you see the flames. Basically, the house is on fire. But look on his expression. He's nonchalant, he's relaxed, he's ignoring the warnings. And I think that picture reflects us. We ignore the warnings. We ignore that chronic pain in our knee. We ignore that heart disease that we're dealing with. But the problem with chronic inflammation, it can promote cancer risk. Now, let's look on the first study. The first study basically suggests symptomatic or clinical prostatitis can increase prostate cancer risk. So prostatitis, which is what? Inflammation of the prostate, can potentially increase the risk for prostate cancer. Also, sexually transmitted infections like gonorrhea. Men, gonorrhea, if they're found, can also increase cancer risk. So here we're seeing that inflammation plays a role in prostate cancer development. And the reason for that is it causes an upregulation of various inflammatory proteins, interleukin-6, right? Tumor necrosis factor, COX-2. All of these proteins are like a perfect environment for these cancer cells to grow, to thrive, and to proliferate. Now, if you're getting a physical, I'm going to encourage you, whether you're a man or you're a woman, always ask your doctor to check your C-reactive protein. And can anyone tell me in the audience what C-reactive protein looks like?
For heart attacks, right?
Someone said heart attack. Okay, that's good. C-reactive protein is basically a marker of inflammation. So it's not just heart attack. It can be anywhere in the body. And men, speaking to you, you want to ensure that your C-reactive protein is less than 0.5. I would encourage you to take some notes. For women, it's different. Women, it should be less than 1. And the reason why there's a difference is because women have more adipose tissue, fat cells, right? Fat cells promote inflammation. Next, we're going to talk about heart and prostate. What does the heart have to do with the prostate? I receive calls every day, and there appears to be a consistent pattern with some of my customers. They will share their experience. Hey, Dr. Walker, I'm dealing with prostate cancer. But during the conversation, one of the things they would share with me is, I'm also struggling with heart disease. So I'm saying to myself, why am I seeing a consistent pattern with our customer base? So I did some investigation, and I found this study. Duke researchers analyzed data from 6,000 men in a 4-year clinical trial testing a drug effectiveness in reducing prostate cancer risk. Get ready for the results. Men with coronary artery disease had a 35% greater risk of developing prostate cancer. 35% greater risk, just because they had heart disease. Also, there was a 24% greater risk of being diagnosed within the first 2 years of the study. So clearly, we're seeing the connection between the heart and the prostate. And we realize that all the systems in the body are not independent. They're all connected, right? Everything is wonderfully connected. So apparently what's good for the heart is also good for the prostate. Any questions on this slide, by the way? All right. Now we're going to move on to dihydrotestosterone, otherwise known as DHT. Now, dihydrotestosterone is a byproduct of testosterone. The testosterone, men, can break down into estrogen, and testosterone can also break down into DHT. Now, too much estrogen can cause belly fat, right? It can also cause what's called gynecomastia. They call that male boobs, right? Too much estrogen. Too much estrogen is also associated with blood clots. They can impair circulation. DHT, however, DHT is responsible for your libido. So that healthy sex drive you're experiencing is not because of testosterone, it's because of DHT. Now, the problem though, too much DHT can cause male pattern baldness, based upon the diagram we're seeing. And too much DHT can do what to the prostate? Can anyone answer that question? I guess not. All right, too much DHT can increase and promote BPH, otherwise known as enlarged prostate. The problem with that, man, DHT can also increase PSA. And if you increase PSA and you're dealing with cancer, that can promote cancer spread, otherwise known as metastasis. So again, you want to ensure that your DHT level is in the optimal range, which is 30 to 50 nanograms per deciliter. All right, so again, encourage your doctors to check your testosterone, encourage your doctor to check your estrogen, but also check your DHT level. All right, now we're going to switch gears, and we're going to talk about how diet can influence prostate cancer. Now, again, I'm only the messenger, all right? Do not shoot the messenger. My entire purpose is to share the information. That's my objective. And this slide says no barbecue, all right? I'm not necessarily advocating you should not enjoy your barbecue, but all I'm saying, high temperature cooking can increase your risk of prostate cancer. Now we're going to look on 3 studies. How many studies? 3. Let's look on the first one. 1.5 servings of pan-fried red meat per week. Not per day, per week. 1.5 servings is equivalent to the palm of my hand, a little bigger. can increase the risk of advanced prostate cancer by 30%. Can you believe that? Just by enjoying that delicious steak pan-fried and doing that for 1 week, you're increasing more aggressive prostate cancer. Here's another study. Men who consume 2.5 servings of red meat cooked at high temperatures were 40% more likely to have advanced prostate cancer. So again, we're seeing a consistent theme. High temperature equates to what? Not only prostate cancer, it equates to more advanced, life-threatening prostate cancer. So if anyone remembers the previous slide, remember we talked about the personality of cancer. It's different when you're dealing with a Gleason 6, which is low grade. It's completely different when our prostate cancer is a Gleason 8, 9, or 10, right? Here's another study. They looked at 1,000 men, and they found that higher consumption of ground beef, you know, I enjoy ground beef, was associated with a 130% increased incidence of prostate cancer. So we're seeing a couple things from this slide. Number one, red meat may increase prostate cancer risk. That's pretty clear, right? Number two, which is a bit more compelling, high temperature cooking also increase prostate cancer risk. And high temperature mean anything above 300 degrees Fahrenheit. You want to take notes. So if you're cooking at 300 degrees or more for extended periods of time, and that means grilling, that means barbecue, that means frying, you're increasing the risk of cancer. Now, let me tell you why. Because once you do so, you create carcinogenic substances called HCA. That's Harry, Cat, Adam. And that stands for heterocyclic amines. And those heterocyclic amines are literally carcinogenic substances that can increase cancer risk. Any questions on this particular slide or thoughts?
What does higher consumption mean? I mean, the first one is like 1 hamburger a week or something like that. And essentially, you're correct. So again, 1.5 servings. 1.5 servings, and I made the example, it's a little bigger than the palm of my hand. Again, let me establish one thing here, people. These studies are not causative, meaning they're not conclusive, okay? And we need to exercise some level of caution, right? And we need to exercise some level of common sense, right? These studies are saying there is association. So back to the gentleman who asked a question, if I'm averaging 1.5 servings, and if I'm dealing with prostate cancer currently, I'm increasing the aggressiveness of a more advanced, life-threatening prostate cancer. And here, the second study said 2.5 servings, and just by increasing the servings per week, not per day, per week, you pretty much magnify the risk to 40%. I don't know if that answered your question. I didn't know what higher meant in number 3, 0.3, higher.
Yes, what I can do, I can go back in the study and I can email the individual who is responsible for the presentation, and they can get back to you with that information. But yeah, that's not a problem. I can send you the specifics of the study. That's not an issue. Any other questions? All right, so let's talk about eggs. I enjoy my eggs. Eggs are quite convenient, rich in protein. 1 egg is like, what, 6 grams of protein right there. And it's very bioavailable, right? But apparently there is some level of association with eggs and also cancer risk. Here we have a study. A study observed that men with prostate cancer who average just under 1 egg per day had a 2-fold increased risk of prostate cancer. versus those who did not eat eggs. Obviously, hearing such information can be disheartening. You enjoy eggs. A 2011 study, those who consume more than 2.5 eggs per week, now we increase the eggs from 1 to 2.5 eggs just per week, showed an 81% increased risk of fatal prostate cancer compared to 1 egg per week. So again, we're seeing where, again, this is not conclusive, it's not causative, but there is some level of association with eggs and more aggressive prostate cancer. And again, not all cancers are created equal. If you're dealing with a low-grade prostate cancer, you're more likely to outlive that cancer versus a cancer with a high grade. So again, keep that in mind. Any questions on eggs? Usually, when I talk about eggs, there's a lot of pushback. One thing I want to share with you though, if you're gonna do eggs, just make sure you do your own research. For example, not because a manufacturer put the word organic means it's fully organic, okay? There is a very good website called Cornucopia. Okay, I can also send that information to the person who is responsible for the presentation. Cornucopia essentially gives you the ranking for each company in terms of their eggs, and which is truly organic versus those who are not organic. So if you insist to eat eggs, make sure you do your own independent research. Okay. Any questions?
I have one question. Does it matter
Yes.
if it's raw, fried, or hard boiled?
Excellent. So again, on the previous study, frying is not our best friend. So if you're doing eggs and it's fried versus raw, you're magnifying that risk. No question about it. Also, when you're scrambling an egg, your oxygen is entering the egg. And remember, oxygen does what to fats? It oxidizes. It causes oxidation. And oxidation can also promote prostate cancer. Oxidized fats are not ideal. So again, if your preference is either raw, absolutely, it's much better than frying. High temperatures is not ideal.
I have a question.
Yeah, sure.
You have the study about egg consumption, and you have a study about red meat consumption. Were the subjects separate? Maybe the red meat guys were eating some eggs, or the egg guys were eating red meat?
Oh, I'm so sorry. I didn't hear the question. Could someone repeat, please? Rephrase the question.
Was there possibly confounding between people eating red meat at the same time they were eating eggs? Comparing the study to this one about eggs.
Okay, so essentially in the study, this study was only about eggs. So the red meat was not a variable or a factor in this study. They only looked on eggs, to answer your question. They did not look on any other variable in the study. And if you notice, in the first study, they compared those who did 1 egg per day versus those who didn't eat any eggs. So that was the only variable they looked on. Now, you're making a very good point. Maybe some of these people are eating more red meat. If they're eating more eggs, one can assume they're eating more red meat. But again, that's just assumption or speculation. But if we're looking on the study itself, it only looked on eggs versus no eggs for the first study. So that was the only variable.
Does hard boiled make a difference?
So again, if you're going to do eggs, it's preferably to use low temperature cooking. So if you're going to do boiling, that's ideal versus frying. So yes, that would make a difference because you're using lower temperature. So yes. And you're not scrambling. Remember, the act of scrambling the egg is also adding oxygen to the egg, which causes oxidation. That's not good either. Because egg, especially the egg yolk, is rich in fat. is pretty much fats, okay? All that fat is oxidizing with the oxygen in the air, and that creates oxidation. So yes, if your choice is a scrambled egg or a boiled egg, go for the boiled.
I have one more question. Eating eggs is frequently associated with ham and bacon, okay, which is mostly cured meats. What kind of contributing factor is the meats?
Oh, I'm sorry, could you repeat the question again?
Eating eggs is frequently associated with fried bacon or fried ham.
Right.
Is there any connection between the eggs and the ham or the bacon?
Sir, so if you're looking on someone who is eating a scrambled egg versus bacon, which is pretty much highly processed smoked fat, yeah, that can significantly increase your risk. Remember, we looked on a previous study where this was talking about ground beef, the third study, but they also mentioned processed meats also increase risk. So any meat that's processed, including bacon, will also significantly increase your risk. So just imagine that scrambled egg and that bacon, that's really a perfect combination, right? For promoting cancer cells. That's not ideal.
If I could just point something out, Dr. Walker, I think all these studies, whether we believe them exactly or not, they're pointing in a particular direction, right? They're giving us some cause. If we have a risk for prostate cancer, or we already have prostate cancer, it behooves us to pay attention to some of these studies if we're going to try to optimize our health or minimize the chance of disease progression. A lot of these studies talk about progression rather than just prostate cancer, right?
I applaud you, and that's one of the things I try to convey.
Okay.
It's not just prostate cancer. It's that these particular foods increase advanced prostate cancer. Thank you very much.
Okay.
Well said.
One other thing is about the eggs. I think there is some causation, right? Because the egg yolk is high in choline, and there have been studies linking choline, high levels of choline, with
yes,
prostate cancer.
I'm aware of that study, but let me just interject. Those studies are not necessarily conclusive. In fact, I don't want to digress too much, but one of the things they use to assess cancer metastasis, they actually do a PET scan called PET choline 11, and they basically find that choline has a strong affinity for prostate cancer. So some individuals assume that, you know what, it's a choline in the eggs that could fuel cancer growth. That could be a cause, but it's not conclusive. I'm going to share with you what's more pressing or compelling than the choline in a few slides, but I'll share that shortly. But good point. Any other thoughts or questions?
What about egg whites by themselves?
Oh, yes. So again, if you're doing egg whites, if you're doing eggs, I would encourage you to do the egg whites. And the reason why, the yolk has a lot of what? Fat. And we're going to find out in a few slides, egg yolk is rich in a certain fatty acid. I'm going to discuss that shortly. So preferably egg white versus egg yolk. You are correct, sir. Now we're going to move on to milk. And I think we can all agree, milk today is not milk 50 years ago. Okay, let's be honest. When you look on a typical milk or the components of milk, you'll find xenoestrogens, you'll find growth factors, you'll find pesticides, you'll find all manner of things in milk today, all right? According to a 2013 study, relatively recent, they looked on approximately 22,000 physicians. They were followed for 28 years. So a pretty good size, good study, good sample size. They were followed for at least 30 years. They were comparing low-fat milk versus whole milk. All right, so let's take a look on the low-fat milk. Low-fat milk was associated with an increase risk of low-grade prostate cancer. So the low-fat milk did increase prostate cancer risk. What kind of prostate cancer did you notice? Low-grade, right? Whole milk, however, was associated with a 117% increased risk of progression to fatal disease. So whole milk also increased prostate cancer risk, but what's the difference? It basically, the cancer became more aggressive. So again, we're seeing that high-fat milk or whole milk versus low-fat milk, just by the constituents of the fat in the milk, plays a role in aggressive prostate cancer or low-grade prostate cancer. Any questions on the milk?
I'm sorry.
No, so go ahead. I was going to ask, what about almond milk or coconut milk? Would that?
I was expecting that question. So again, there's no studies on non-dairy milk. Obviously, these milk are plant-based, and if you compared it with whole milk or skim milk, if you look on the percentage of fat you're getting from non-dairy is virtually free. Again, we're seeing a consistent theme with animal protein. And one of the consistent themes I'm seeing is the fat level or the percentage of fat, because again, whole milk versus low-fat milk, there was an increased risk of more aggressive prostate cancer. So again, if you're going to do milk, I would strongly endorse, obviously, non-dairy milk. With that said, let me interject for a minute. Keep in mind, some non-dairy milks have something called carrageenan, okay? It makes the milk very viscous. The problem with that, carrageenan is also associated with cancer, okay? So some companies are removing that from their milk. So again, if you're selecting almond milk, read the back, read the supplements to find out if there's any carrageenan in that milk. And I personally would stay away from it. By the way, it's derived from seaweed, just so you know. Any thoughts? Any other questions?
Yeah, I have one other question. The wording that's used is associated and higher risk, and sometimes risk may be associated with causation, and association is just that. It's not causation; it's association.
You're correct. You're correct. Remember and sir, we're on the same page. These studies are not conclusive. Okay, I agree with you. They're not conclusive. However, are we going to dismiss the research? I don't think we're going to dismiss it. We're gonna basically extract what we need, and we're basically going to use that to better our lifestyle habits. And I understand one of the biggest challenge that I deal with every day with customers is not supplements. It's very easy to take supplements. It's not easy to change lifestyle. So again, it's not causative, it's association. So thank you for repeating that.
The other question I had, your skim milk has a low incidence of prostate cancer. The whole milk, 117% higher incidence. So is the implication that no milk at all is the best? That it has the lowest incidence?
Sir, honestly, I don't drink milk based upon these studies. And based upon my family history, I need to be proactive. So I can't decide for you guys. You need to decide based upon the information. But again, just to clarify, low-fat milk did increase prostate cancer, but it was low-grade. But I personally avoid milk completely. But that's just me. Any other questions? I know whenever I'm talking about dietary adjustments, it can be a bit challenging because it requires you changing habits. That's not easy, all right? But I also understand the challenges with changing habits. But let's move on to chicken. All right, so the question I'm asked every day is, chicken safe, Dr. Walker? Can I consume my delicious baked chicken or my fried chicken? Well, the answer to that is yes and no. All right, reason, take a look on the first study. A Harvard report showed men with prostate cancer who consumed a large amount of chicken. And by the way, sir, I will get back to you, the person who asks what's higher mean, what does higher mean? I will get back to you on the exact amount of the chicken. I'll send all that information via email. But those who consume a large amount of chicken quadruple their chance of the disease progressing. So again, we're seeing where by consuming animal protein, you can quadruple the chance of a more aggressive prostate cancer. However, let's take a look on the second study. And this is where I was confused. Let's take a look on the study below it. Another study found that baked poultry was inversely associated with advanced prostate cancer. So one study is saying chicken may quadruple your chance, right? Another study is saying baked poultry, there's an inverse relationship. So once I dig deeper in the first study, just so you know, they consumed the skin of the chicken. So in the first study, the skin of the chicken was consumed, and they found out by consuming the skin, it basically increased disease progression, right? As opposed to the second study, the skin was not mentioned in the study. It was not consumed. Secondly, obviously the poultry was baked. It wasn't fried, it wasn't grilled, it wasn't barbecued. And there appears to be some level of protective effects with baked chicken. Now, again, if you are convinced that you need to avoid animal protein, listen, I support you 100%. However, it appears that baked poultry may have some protective effects. Any questions on the baked poultry or this study on chicken? All right, no questions. Now we're going to move on to the reasons why. Why is it that certain foods may promote more aggressive prostate cancer? And the reason why is what they call arachidonic acid. Some of these foods, especially the foods that were mentioned, they're loaded with arachidonic acid. And arachidonic acid is a fatty acid, okay? That fatty acid, when it's in your body, basically activates and turn on inflammation. And it becomes certain types of inflammatory proteins that basically promote a more aggressive cancer. For example, with arachidonic acid, you increase the production of something called 5-lipoxygenase, otherwise known as 5-LOX. And 5-LOX can facilitate the propagation, infiltration, and metastasis of cancer cells. You also increase the accumulation of leukotriene B4. That can basically be a culprit for arthritis. That can damage your joints. And also you increase something called 5-HETE, and that prevents something called apoptosis. Remember, apoptosis means what? Cell suicide. We want these cancer cells to commit suicide. But if you're producing 5-HETE, guess what? The cancer cells are going to live forever. You're going to be immortal. You're not going to undergo apoptosis. All right, let's move on to, now we just talked about how diet can promote prostate cancer, right? Now the question to the audience, can diet reverse or reduce risk of prostate cancer? What are your thoughts?
Yes.
Oh, that's a resounding yes. Anyone else? So here we're looking on a study. It's called the Ornish study. Basically, this study looked on 93 men with low-grade prostate cancer. And they elected not to undergo any conventional treatment. So they decided not to do surgery, they decided not to do radiation. So the participants were divided in two groups, a control group and an experimental group. And essentially, after 1 year, PSA levels decreased in the comprehensive group. That's a group that underwent the lifestyle changes, while PSA increased in the control group. That's a group who did not do the lifestyle changes. Now, for some of you who are curious, what exactly did the lifestyle change include? Basically, it's a vegan diet. So there was no fish, no meat whatsoever, all right? So completely vegan. So it was basically fruits, vegetables, whole grains, legumes. They also supplemented with soy. So wow, can you believe that? They also took some soy, also had some vitamins and minerals. They participated in aerobic exercise, again, getting more oxygen to the tissues, right? Remember that? They also did prayer, all right? So the spiritual component were more than physical beings, right? And a weekly support group session. There was a registered dietitian available for consultation, and a nurse care manager contacted the participants once a week. So again, this was a pretty intense program. And I had the privilege of speaking to one of the customers. And he said that, Dr. Walker, the program was successful. It actually lowered his PSA. And I said to myself, why are you not on the program today? And he was very honest, and I appreciate him for that. He said, the program was so intense, compliance was an issue. Because people had to change their lifestyle. People had to change their eating habits. And again, it's really difficult to address habits, right? In fact, some of the participants had to leave the study because it was so intense, even though they got results. All right, so again, it's never easy to change your dietary habits. But what's more impressive, if you look on the fourth bullet point, you see that the serum from the participants inhibited prostate tumor growth in vitro by 70% in the lifestyle change group, while only 9% in the control group. So let me paraphrase that for you. So essentially, the group that underwent that stringent lifestyle change after 1 year, they essentially took some of their blood sample. They applied their blood sample to a petri dish full of cancer cells, prostate cancer. And what they found just by applying that blood sample to that petri dish, it inhibited tumor growth by 70%. Isn't that impressive? Just by changing your diet, you're changing the biochemistry of your body. And it makes sense because with all these greens and these vegetables, you're getting those enzymes, you're getting polyphenols, you're getting anthocyanins, and you're making your body into a situation where cancer cells cannot thrive. So again, there's power in the diet, right, guys? And we're seeing it in this study. Any questions or thoughts or any experiences you want to share? Now we're going to move on to a Mediterranean diet. I think we all know about the Mediterranean diet. I can be honest with you. I think I would struggle with a vegan diet. I enjoy my fish from time to time. Here we're looking on 700 men with prostate cancer and about 1,200 healthy men, right? The average age, 66 years old, right? 5-year study, so a pretty good length, okay? They basically collected various information such as medical background and their eating habits. Now, the participants were placed in 3 groups. How many groups? 3. You're the Western, you're the prudent, you're the Mediterranean group. So we need to understand what each group includes, right? So Western group basically had large intakes of fatty dairy foods, processed meats, fast food, refined grains, sweet sauces, and high caloric drinks, like your soda, right? The Western diet to me is like convenience, all right? It's accessible, it's easy, less work, it's available, all right? Let's take a look at the prudent diet. So the prudent individuals made better choices, right? So they had low-fat dairy foods, so low fat, okay, good. Fruits, all right, that's good. Vegetables, whole grains, and juices, all right? So not bad, all right? Let's take a look on the Mediterranean diet. So we're seeing high intake of fish, okay? We're seeing fruits, vegetables, boiled potatoes. I was kind of surprised by that. Legumes and olive oil, obviously virgin olive oil, okay, people? Virgin, all right? There's a lot of scams out there with olive oil, so do your research. With low levels of juice intake. Very interesting. They said low levels, right? So each dietary pattern had 4 categories, okay, of compliance. So whether they were low or whether they were high, all right? So let's move on. So here is the conclusion of the study. Only the high compliance group, that's the Mediterranean group, was significantly associated with a reduced risk of having prostate cancer with aggressive and extensive tumors. No such link was found in the other dietary patterns, either with aggressive or less aggressive tumors. So are you saying to me, Dr. Walker, even though I'm making prudent choices, meaning I'm doing low-fat dairy, I'm doing my fruits, I'm doing my vegetables, I'm doing my whole grains and juices, are you saying to me I'm not getting much benefit in reducing aggressive prostate cancer? I'm not saying that. The study is saying that. The study is making it clear for you to really get that clinical benefit. It simply means that we need to be a bit more consistent with a Mediterranean diet. Do you have any questions on this particular study?
I have
Very
a
interesting study.
Back to dairy products in the Mediterranean diet. Is cheese part of the Mediterranean diet?
No, cheese was not mentioned in the study. Absolutely not. No dairy. I know, right?
Yeah.
Yep. We need to make some changes, everyone. I'm telling you. Again, it's always difficult to change habits. Any other questions? All right. Okay. So I guess we can move on.
Well, yeah, it seems that that's a little inconsistent with the previous slides, saying, you know, if you reduce your red meat intake and all that stuff, you know, you're going to be better off. But then the prudent diet did all that and didn't have any effect.
Oh, I'm sorry. Could you repeat a question, or could someone just rephrase that, please?
I'm sorry. The previous slides all suggest, you know, reduce red meat, maybe even chicken and eggs and go to low-fat dairy, and all those things would be beneficial. But then you look at the prudent diet, and that's what they did: low-fat dairy, foods.
Sir, well said. And that was my same thought process. And one thing you need to realize: no studies are going to basically be the same. And I think that's pretty clear, right? And essentially, this study is basically saying that a prudent diet, and I know, I don't think anyone in this group is practicing the Western diet. I can bet my life on that, okay? I'm pretty confident. But I know many individuals, they're doing a prudent diet. And again, I'm not here to discourage you. I'm here to give you the information so that if you can push yourself to another level, do so. We can always make improvement. Pretty much that's my purpose. What improvement can you make? For example, one thing I'm going to try and do, instead of using a lot of coconut oil, I like coconut oil, okay? My culture uses a lot of coconut oil. Based upon this study, I'm going to start implement more extra virgin olive oil. And it makes sense because olive oil is rich in polyphenols, right? It helps to reduce metabolic disease. And clearly, olive oil was mentioned in the study because there appears to be some anti-cancer properties. So you can take away something from this study and improve on one particular area. All right. Any other thoughts or questions?
I have a thought.
Yeah, please share.
Since my husband was diagnosed, we have really changed our eating habits a lot. And we've, over this period of time, we've stopped red meat totally. We don't grill anything. Many of the things that you mentioned, a lot of vegetables, organic foods, etc. And one day we were with one of his doctors, and it just occurred to us that over the past 4 years, we have not had a cold. And we said to the doctor, why do you think that is? And he said, because you have significantly changed your diet.
Wow.
So it helps in many other ways, not just with the prostate.
Absolutely. You know, I know I'm talking about prostate cancer, but I think we can all learn from different cancers, right? They did a study with women with breast cancer. These women, all they did, this is what all they did, they basically reduced their carb intake by 27 grams. What that simply means, they basically removed that medium-sized banana every day. All right, a medium-sized banana is 27 grams of carbs. They found that there was an improvement of survival by 40% just by making adjustments in their carb intake. So again, diet makes a profound influence in how we deal with cancer and various metabolic diseases. So thank you very much for sharing that. So we can literally change our biochemistry. We have that control. We have that power. The question is, are we going to use it? All right, next, we're going to move on to the next study. This study basically looks on the Mediterranean diet again. This is a prospective study, 50,000 men. All right, they were followed for 24 years. All right, half a century. There was a 22% lower risk of overall mortality. So basically, you are less likely to die from prostate cancer if you implemented a Mediterranean diet. By the way, this study was separate and apart from the previous one I just mentioned. All right, so clearly we're seeing some benefits with Mediterranean diet.